Hello. So good afternoon. This is a very nice case today. I would like to share with you. This is a 26 years old woman with a history of epigastric pain, with irradiation to the back, and a history of gallbladder surgery. So 6 years before. The situation with this patient is that she have cholangio MRI that have the question about the possibility of stones inside the biliary tract. So what I see and what we'll do, so she have an anastomosis, intestinal, biliary intestinal anastomosis. So the approach could be done first by double balloon enteroscopy or enteroscopy. That could take a lot of time. And second one, by US cholangiography. The situation is that this patient, during my evaluation with US, I didn't see really I see a big dilation of the biliary tract, you can see there, but there is also cholangitis, and I see air inside the biliary tract. So it's very difficult that having air that this patient have an stenosis. Moreover, that this patient doesn't have high levels of bilirubin. Bilirubin levels are almost normal. So I don't see. I see air in the biliary tract. There is a big dilation. It's clear. And also, what I see that is an advantage of endoscopic ultrasound over enteroscopy is that we can see the liver. If you can see the liver, this patient have a irregular shape of the liver. So, to my opinion, for the clinical aspects of this patient, you can see here, this patient have an irregular liver, and probably this patient already have, after 6 years of cholangitis, recurrence of cholangitis every year, probably she have already now liver cirrhosis, and we don't know. We really don't know. I don't know how are the platelet levels. So platelet levels are normal, and we need to evaluate. So what is the advantage now? First, I can reach the biliary tract, and second, I can do cholangiography. I can perform aspiration. I can send this to the lab to be evaluated if there is any bacteria inside. And third, second, I can do a cholangiography, and third, at the same time, I can do a liver biopsy just to be sure that this patient is not starting a liver cirrhosis. So I think it's a lot of more advantage to doing this approach. Moreover, you need to know that if I see air, probably there is no stenosis, there is not obstruction, even if there are some stones inside. So I can have the chance once to try to treat by US in the anterograde way, doing a balloon dilation and then pushing the stones. But if I cannot do it, that I have my radiologist already here near to do drainage or percutaneous drainage also, and to solve the case, to try to solve the case. But I believe that this more than an stenosis with stones, probably this patient have cholangitis by reflux. So we will perform first an approach of the biliary tract, and to try to perform an aspiration. Then we will do a cholangiography, and then we will evaluate what should be the next step. And finally, I will do a liver biopsy. So I think is this the best way and the best approach. We can have a very nice case today to try to solve try to do a solution to this patient. So first, I am here at the level of the stomach, transesophageal. You see here there is a dilation here, so there is no flow here, and there is this is the biliary tract that I will intrahepatic biliary tract that I will try to reach. So I will use a 19 gauge needle. You can use a normal needle. I will use the spec needle from Boston Scientific. So one very good tip is try to pass over. I think I am inside. I will try to see. It's nothing coming. Nothing coming. So there is blood. I am inside a vessel. I am not good. I need to clear here, clean. Bota eso. Dame solución salina, por favor. Ten aquí. Okay. So I will try to reach another dilated duct. You can see here this is air. So I will try to reach there. Okay. Now we are no. We're not good again. Toma. Quiero limpiar. Oh. Sometimes it's not so easy. If you cannot try to do it by using a 19 gauge, you can use a 22 gauge needle, okay? Dame. I think we are. Okay, I will see that. Dame solución salina primero. Cero contraste. Sí. Yes, we are. We're inside. Dame más contraste. Podemos ver la flora, por favor. So we're inside, huh? So you can see. Sí. Okay, there is a pass of the contrast inside the small bowel. Photo. As you can see here, there is a very good pass of the contrast. So the problem is not there. Dame solución salina. The problem is not that stenosis. And what do you see here in the middle, like a nodule, is just a biliary tract, and there is air inside. Solución salina, ¿no? You see? Very well, there is a good pass. And the más solución salina. Dame video. Gracias. So there is no stenosis, and I think that this patient what have is reflux, biliary reflux with cholangitis. So this patient needs to be treated just by antibiotics, and we need to see what will happen. You can see there is a big disease of the biliary tract. It's very regular. You can see. So the only dab for thinking that there is some stones is here, just in the middle. But I believe it's more than the stones. Is there is not stones. There is air. This is air. That's the difference between cholangiography and MRI, cholangio MRI. So there's a good pass of contrast. That's why the bilirubin levels are normal, and that's why we have error inside the biliary tract. So I think there is nothing to do here regarding therapeutic by endoscopy or radiology in this case. And what we will perform is a fine needle biopsy of the liver just to see if this patient have liver cirrhosis now. So I will provide this cholangiography. This uses cholangiography to do that. You can see, look, the bowel is perfect. The pass of the contrast is going to the bowel, and there's a reflux. You can see it. Okay? So we need to discuss that with surgery probably. But first and all, we need a liver biopsy. Okay? So I will change my needle now. Give me more water, agua. Cógeme esto. El cable. Ok, listo. Solo tenlo en la mano. Gracias. Sí. Ok, dame la imagen de ecografía, por favor. I will clean up. Esa vamos a mandar a patología. El líquido. No, ahorita ya no se puede. Esto es agua. Agua. Dame aspirar. Toma. Toma afuera. Ok. Dame ahora una aguja 19 Antwire. So I will change my needle. I will use a 19-gauge needle Antwire for liver biopsy. And we will do. You can see here the whole biliary tract have hyperechoic areas, and these hyperechoic areas means that there is chronic cholangitis here. So we will see. We saw that also in the cholangiography. It is a very regular biliary tract. What is the big difference, or I think what is the pearls of this technique is that we have a most complete approach with this patient, because if we do cholangiography by enteroscopy, in this case probably we didn't have the whole vision of the problem of this patient. But now, doing by US, you can see here my needle. I am using an acquired needle. That acquired needle have a special. No quiero tanta aspiración. Necesito menos. Using an acquired needle, I will have a good quantity of tissue of this liver, and I need that my pathologist say what is happening here, that probably there is a liver cirrhosis. So you can see my needle here, huh? So I don't use a lot of aspiration when I do my liver biopsy, because it could comes less blood using this 19 gauge needle. So I pass, as you can see, the whole liver. Just to see what we have. Try to change my position. You can see here the needle. Dame un poquito más de aspiración, por favor. A 10 o 15. So let's go to see what do we have. Okay. Chico, que hay muestra, mira. Aquí hay muestra, mira. Hay que recogerlo. ¿Puedes tener aquí? Can you just take here? A ver, perdón, un segundo. Un segundo. No, no hagas nada. No. Calma. Ven acá. Okay. Abre. Abre. Dale. Ok, listo, gracias. Prende la luz. ¿Dónde está la tapa? Vamos. So, I think we have a very good. Puedes poner la cámara principal. We have a very good tissue. You see here. So it's a very good tissue. You see there? Very nice fine needle biopsy. So I think we finish here. This patient need to be evaluated after that. We need to see if this patient have liver cirrhosis or not. And we will close the transmission. But before to close the transmission, okay, my friend, thank you. This is my fellow, my good fellow from California, Jorge Guzman, the new top one of Chico. So we will close the transmission, but before to close the transmission, I would like to invite you to our live endoscopy course that will be held here in Guayaquil in May. We have more than 40 experts invited, and we will have hands-on with all the new technology, Barrix, radio frequency, hot axios, the new needles, clips, endoflip, esoflip, and all the new scopes from Pentax Medical, the US scopes, also from Fuji Film. And we would like to invite you to participate with us. This is a very nice live congress with more than 20 cases that will be transmitted to the Sheraton Hotel here in Guayaquil. We have more than 450 physicians already subscribed. We don't have more spaces for the hands-on, but will be a very nice event. And also to invite you to the ASG IECED with together with WEO. There's a live endoscopy online course that will be held in August from this center. So follow us, join us in the Endo Club. That is for free. www.pentaxcenter.com, and you are welcome to be a member of this club that is for free. You will receive a newsletter with the new technology the whole time. As well, you can have access to all the library, a video library that we have with all of our cases and all more benefits that you need to read in our web page. So thank you so much. Cortamos la transmisión.